Terrazine B. In today's section, we are going to discuss about Azole group of antifungal drugs. This is a major class of antifungal drugs used for a wide variety of fungal infections. This is characterized structurally by the presence of an azole ring. It is a 5-membered ring with nitrogen atom incorporated within it. It is classified into imidazoles and triazoles. The imidazoles have a 2 nitrogen atom and triazoles have a 3 nitrogen atom. The imidazole includes ketoconazole, which is available as oral and topical formulations. Both oral and topical formulations are available for ketoconazole, which is the prototypic drug. It was introduced in the year 1977. So ketoconazole is the prototypic drug belonging to Azole group. The topical formulations are clotrimazole, miconazole, Itraconazole and Terconazole. The triazole group of antifungal drugs includes Itraconazole, Fluconazole, Voriconazole, Terconazole and Posaconazole. So these are newer Azole group of antifungal drugs which have replaced the use of ketoconazole. Now let's begin with the prototypic drug, that is ketoconazole, which is available in both oral and topical formulations. The molecular target of ketoconazole is an enzyme, that is 14-alpha-sterol demethylase enzyme. So this enzyme is responsible for the conversion of lanosterol to ergosterol. As we know that ergosterol is an important component of fungal membranes. So by inhibiting the enzyme, that is 14-alpha-sterol demethylase, ergosterol synthesis is inhibited and this causes destabilization of fungal membranes and inhibition of fungus. So the action on fungus by ketoconazole is fungistatic in nature rather than fungicidal. Now do note that this enzyme is a microsomal cytochrome P450 enzyme, but the ketoconazole is not completely selective for this enzyme. It also inhibits hepatic cytochrome P450 enzyme, and this is a drawback because this leads to drug-drug interactions. So drug-drug interactions is an important consideration when azoles are used, because the azoles, particularly the imidazole group of azoles, are not completely selective for fungal enzyme, fungal cytochrome P450 enzyme. They also inhibit hepatic cytochrome P450 enzyme, and this is the cause for drug-drug interactions. An example of drug-drug interaction between azole and another drug, for example, cyclosporin. So cyclosporin is an immunosuppressive agent and it prevents graft rejection in recipients of kidney, liver and lung transplant. So when azole is administered along with cyclosporin, it inhibits the hepatic cytochrome P450 enzyme, thereby leading to accumulation, decreasing the metabolism of cyclosporin. So because of reduced metabolism of cyclosporin, it accumulates, leading to toxicities such as nephrotoxicity and hepatotoxicity. So patients receiving azoles and cyclosporins have a higher incidence of drug-drug interaction. They are more susceptible to toxicities resulting from cyclosporin, so they should receive lower doses of cyclosporin. So cyclosporin dose should be minimized in patients receiving azoles and cyclosporin, patients receiving both these drugs. So drug-drug interaction is an important consideration when azoles are used because of the inhibition of hepatic cytochrome P450 enzyme. What are the other drawbacks of ketoconazole? They inhibit the steroid hormone synthesis in the adrenal glands and gonads. Because of the steroid hormone synthesis in the adrenal glands, there can be persistent adrenal insufficiency at high doses. Also at high doses, there is inhibition of steroid synthesis, and this can cause impotence and gynecomastia as adverse effects. So adverse effects such as impotence, gynecomastia, adrenal insufficiency, drug-drug interactions. So these are some of the adverse effects that are associated with the use of ketoconazole. However, the property to inhibit androgen synthesis can be exploited therapeutically by some clinicians who prescribe ketoconazole in advanced prostatic cancer. So in advanced prostatic cancer, ketoconazole can be prescribed to decrease the androgen synthesis, thereby decreasing the androgen levels and treating prostate cancer in the advanced stages. In recent times, ketoconazole use has declined because of other safer alternatives and because of certain drawbacks. So what are the drawbacks of oral ketoconazole? Firstly, it requires an acidic environment for absorption. Because it needs an acidic environment for absorption, patients with achlorhydria or patients who are receiving H2 blockers, bicarbonates, proton pump inhibitors, which increases the pH, which increases the alkalinity, decreasing the absorption of ketoconazole and decreasing the bioavailability. So, ketoconazole use is avoided in these patients. Secondly, ketoconazole has little penetration into the CSF and urine. Therefore, it has limited efficacy in CNS and urinary tract infection. So, ketoconazole is not an effective drug in the treatment of meningitis, CNS infection or urinary tract infections. We have seen the drawback of oral ketoconazole. Ketoconazole is also available topically. So, topical ketoconazole is useful for treating superficial skin infections, superficial fungal infections of the stratum corneum. They have cutaneous and vaginal applications. However, do be kept in mind that they are not preferred, they are not used in treating infections of the hair and nail where glycofulvin is the drug of choice. So we have seen the drawbacks of oral ketoconazole. Ketoconazole is also available topically. Topical ketoconazole is used for treating superficial fungal infections. They have cutaneous and vaginal applications. However, to be noted that they are not effective in hair and nail infections where glycofulvin is the drug of choice. Then there are other topical preparations that are grouped under imidazole group, and these are clotrimazole, miconazole, itraconazole, terconazole. They are used for treating superficial fungal infections of the skin and mucosa. With respect to uses of oral ketoconazole, the oral ketoconazole use has been declined in recent times, but before restrictions, they were used for the treatment of systemic mycosis, that is histoplasmosis, blastomycosis, coccidioidomycosis. These are largely replaced by itraconazole and amphotericin B. So oral itraconazole, also intravenous itraconazole, has largely replaced ketoconazole in the management of systemic mycosis. The next use is refractory dermatophytosis such as tinea corporis, pedis, capitis not responding to other topical therapy can be administered oral ketoconazole. So now that we have covered the imidazole class of azoles, which includes ketoconazole and other topical formulations such as clotrimazole, itraconazole, miconazole, terconazole. Let's now discuss the triazole class of antifungal drugs, and it includes Itraconazole, Voriconazole, Posaconazole. So starting with Itraconazole, it has largely replaced oral ketoconazole. Like ketoconazole, it also requires an acidic pH for absorption. So in absence of acidic pH, the bioavailability decreases. So acidic pH influences the absorption of itraconazole just like oral ketoconazole. Also, there is a risk of hepatotoxicity associated with itraconazole. So these are some of the drawbacks of itraconazole, which is similar to that of ketoconazole. And because of decreased absorption, itraconazole is available as IV formulation unlike ketoconazole. So itraconazole is available as oral and intravenous formulations, and bioavailability can be enhanced with IV administration. In terms of its antifungal spectrum, itraconazole is useful for treating systemic mycosis such as histoplasmosis, blastomycosis, coccidioidomycosis. It attains high concentration in the meninges and therefore useful for treating cryptococcal meningitis. Candidal infections can also be treated with itraconazole. Also, they are effective in aspergillosis. Let's now move to the second drug, that is Fluconazole, which is available as oral and IV formulations. Fluconazole has 100% bioavailability. The absorption is not affected by pH. pH does not influence the absorption of this drug, and therefore the bioavailability is 100%. This is unlike ketoconazole or itraconazole. Also, it freely diffuses into the CSF, urine and saliva. And because it attains high concentration in the CSF, it is useful for treating infections of the CNS and urinary tract infections. It is useful for treating cryptococcal meningitis. It is the drug of choice for treating systemic candidiasis. However, to be kept in mind, they are less effective than Itraconazole in the treatment of systemic mycosis such as histoplasmosis, blastomycosis, coccidioidomycosis, and to be noted that it is not effective in aspergillosis. So fluconazole is not effective in aspergillosis, should not be used in the treatment of aspergillosis. It's a drug of choice for systemic candidiasis, cryptococcal meningitis, attaining high concentration in the CSF, urine, good bioavailability, but drug-drug interaction is also a consideration with fluconazole. The next drug is Voriconazole. Voriconazole is also available as oral and IV formulations, and it is the drug of choice for treating invasive aspergillosis and candida species. Infections related to candida, candidiasis and invasive alkalosis, the drug of choice is Voriconazole. Lastly, the two drugs that come under triazoles, that is Terconazole and Posaconazole. Terconazole is available as a vaginal suppository and is used for treating vaginal candidiasis. So it is useful for topical application, available as a vaginal suppository, and is useful for treating vaginal candidiasis. Coming to Posaconazole, they are useful in patients with profound neutropenia, HIV patients, immunosuppressed patients, patients undergoing transplant. They are used for prophylaxis against invasive fungal infections. Secondly, they are used for treating oropharyngeal candidiasis in patients who are refractory to fluconazole or other drugs. Also, they are useful for treating invasive aspergillosis in patients who are refractory to Voriconazole, amphotericin B and echinocandins, a newer class of antifungal drugs. So, Posaconazole is a reserved drug. They are used in patients who are refractory to newer drugs such as echinocandins, Fluconazole, Voriconazole, Itraconazole or amphotericin B. Also, they are used in immunosuppressive patients, in immunocompromised patients as prophylaxis against fungal infections. So this is all about the azole group of antifungal drugs which are categorized as imidazole, triazole. So we have discussed the therapeutic uses, adverse effects, antifungal spectrum about the azole group of antifungal drugs. If you find this video useful, please share, subscribe, like to this channel. Thank you for watching.